New videos every day.
Life, wisdom, Psychetruth, massage.
Hi everybody, this is Gregory Gorey with bodyworkmasters.com, and today we're going to talk about iliotibial pain and dysfunction. This IT band is a big band of fascia that can get glued to the quadriceps or the hamstrings, and when that happens it can create knee pain or hip pain. Now the traditional way that people are taught to take care of this is through foam rolling. So I'm going to have you demonstrate that. So let me have you come onto your side. You're going to put this underneath your IT band, and then you're just going to roll back and forth and then come up and back. And this is generally really tender on people, especially if you've got bicyclists or runners, and that's good. The problem with doing foam rolling, as opposed to what we're going to demonstrate with the Soma cups, is that if this is glued down already, taking a glued down tissue and then mashing it down on the foam roller is not nearly as effective as lifting and separating this tissue off. So we're going to take some cups and we're going to lift and separate all of that tissue off. There are other techniques that you can use without the Soma cups. There's a video that I did about bicycle injuries that demonstrates several techniques for the IT band, but I have yet to find anything that is more effective for creating space and relieving the tension of tight IT bands than these cups. So we're going to come in, we're just going to warm up the tissue a little bit. I'm not doing any suction, I'm just warming this up, trying to desensitize this area, because if you've got a runner, if you've got a bicyclist, somebody that's got really locked down IT bands, this can be really intense. So you have to check in with your client. So we're warming this up. No suction here, just general light work. All right, so we're coming in with about a 2. So just a little light suction, getting this tissue adjusted to this. This might take 2 or 3 sessions before you can really get in there and apply a 6 or 7 or even a 9 on the tension scale, but we want her nervous system to be able to calm down. So you can already start to see the blood flow coming in, and this IT band, the quadriceps come here and they start right about there. You can actually see the indenture of the IT band coming down and stabilizing from the hip into the knee. So we're going right over it, little light circles. IT band actually comes all the way up and starts right here at the tip of the hip here. That's your tensor fascia lata. So right there, I'm actually just going to put a second cup, and I'm going to cup her IT band here and just leave it there as I do this with less pressure here. Is that okay there? Yes. Too much? Okay. It tickled a little bit when you first put it on. Okay. So coming across the quadricep. This is also really effective. She's got a couple little scars from a childhood injury with had a run-in with a barbed wire fence. Sometimes scars will actually lay down fibrotic tissue that can adhere to other tissues, and these cups are really excellent. So I'm just going to concentrate on these scars, and you'll see they'll go from white to kind of a bright pink here in a minute. We'll circle both directions. I'm primarily focusing, you can go and release the entire quadricep, but my primary goal is creating space between the IT band and the quadricep right through that line. And we're going to take this off. So she's got a nice flow of blood into there. Tensor fascia lata is right there. Good. Still okay? Okay. Lifting and separating all of this tissue. So we put a static cup at the top of it. I'm going to put a second one right down here at the edge of her knee. And because I'm not moving that, it's in a static position, I can go into a deeper suction because it's not going to, if I were to go in as deeply as I did with that cup and start moving it, she would jump off the table. But because it's static, oops, we can leave it right there. Is that okay? Okay. You can even do this on yourself if you've got really tight IT bands. It's a little intense, but it's less intense and much more effective, in my opinion, than foam rolling. Good. So you can also come in with your finger, relax your leg there. So I'm going to come and feel right for the edge of right there. And then I'm just going to come in with my thumb and try to separate that off. So it starts up here at this TFL, but it also has a component that it merges with the glutes up here. So we're going to get up into this area a little bit as well. Perhaps the overhead cam will capture this, but her skin is actually a 1/4 inch into the cup. It's literally lifting and creating space in between and differentiating these tissues. Come in from the underside where the hamstring attaches. Do the same thing, kind of lift and try to just pull that off and over. So we've been doing that for a couple of minutes with about a 3. I'm going to try to bump this up, but again, you're going to have to check in with your client and see what's within their comfort scale. Little mild discomfort is okay. Shouldn't be jumping off the table or holding their breath. So this was a 3 before. Now we're going to take it to about a 5. Is that okay for now? Is that too much? If it's too much, let me know. And it's fine. And this is also going to have different amounts of discomfort on different spots. So where you have adhesions, where it's glued down, it's going to be more tender. So got a little more suction. You can tell like I'm literally trying to, pull that off. I was successful there. Okay, so I'm going to take my smaller cup and do a little bit more. There we go. Thank you. All right, well, I hope you enjoyed this demonstration. We got up to maybe half of what the cups could do as far as their suction, but that's a good starting session. If I were to see her again next week, we would be able to get deeper into it. So it's a really remarkable tool. I hope you enjoyed the video. If you have interest in attending a seminar, I'm going to start teaching this for continuing education credits. Check out bodyworkmasters.com, and don't forget to like and subscribe. We'll see you next time.